What if I told you that the nightly trips to the bathroom, the weak stream, and that feeling like you never fully empty your bladder could be dramatically improved without going under the knife? Most men over 60 have never been told that their enlarged prostate symptoms do not automatically mean surgery is their only option. Here is something that quietly destroys quality of life for millions of men, yet most doctors only offer two choices: expensive procedures or a lifetime of medications. I am Dr. Eva Hart, a certified urologist who has spent 14 years helping men reclaim control over their bodies and their confidence. I have seen thousands of men who believed they were destined for expensive procedures or invasive surgeries, only to discover that their bodies had an incredible capacity to heal naturally. In my years of practice, I have watched men transform from feeling helpless and embarrassed to becoming advocates for their own health. This is not your fault. Society has conditioned us to believe that aging means accepting decline, that every symptom requires a prescription or a procedure. But I have talked to hundreds of men facing the same struggle, and I can tell you with certainty that your body wants to heal. It just needs the right support and guidance. Today, I am going to share with you 7 natural approaches that can significantly reduce enlarged prostate symptoms. This is not about quick fixes or miracle cures. This is about understanding your body and giving it what it needs to function optimally. This is about more than just urination. This is about reclaiming your dignity, your sleep, your peace of mind, and your confidence as a man. Stay with me until the end, because what I am about to share could change how you approach your health for the rest of your life. And if this resonates with you, let me know in the comments what brought you here today. Your story matters, and it helps other men realize they are not alone in this struggle. Let me start by addressing what brought you here. You might be experiencing a weak urine stream that takes forever to get started. Perhaps you find yourself waking up 3, 4, even 5 times each night to use the bathroom. Maybe you finish urinating but feel like your bladder is still half full. Or you notice that embarrassing dribbling after you think you are done. If any of this sounds familiar, you are likely dealing with an enlarged prostate, medically known as benign prostatic hyperplasia or BPH. You are not broken, and you are certainly not alone. What many men do not realize is that these symptoms often develop so gradually that they accept them as normal aging. But just because something is common does not mean it is inevitable or untreatable. I am not here to sell you expensive treatments or push you towards surgery. My goal is to help you understand that your body has remarkable healing abilities when given the right support. While surgical options exist, they should be your last resort, not your first choice. I have dedicated my career to finding alternatives to invasive procedures because I have seen too many men suffer unnecessary complications from treatments that were not truly necessary. Every man deserves to know his options before making irreversible decisions about his health. The medical system often presents surgery as the most reliable solution, but what they do not always tell you is that natural methods can be just as effective for many men, especially when implemented consistently and early. Your prostate naturally grows as you age. This is not a disease, it is a normal part of being male. However, modern lifestyle factors accelerate this growth and worsen symptoms. Poor diet, lack of movement, chronic stress, and inadequate sleep all contribute to inflammation and hormonal imbalances that make your prostate work against you instead of with you. Truth is, if you do nothing, symptoms typically worsen over time. But unlike many age-related changes, prostate health responds remarkably well to natural interventions when you know what to do. Your prostate is not a mysterious organ that operates independently of your overall health. It responds to the same principles that govern your cardiovascular system, your immune system, and your hormonal balance. Let me explain what is actually happening in your body so you can understand why the methods I am about to share work so effectively. When your prostate enlarges, it squeezes your urethra like a garden hose with someone stepping on it. This creates that weak, hesitant stream you have been experiencing. The muscle contractions that should create strong urine flow become inefficient because they are working against increased resistance. Incomplete bladder emptying happens because the enlarged tissue prevents your bladder from fully contracting. Think of trying to squeeze water from a sponge while someone is pressing down on part of it. This residual urine creates that persistent feeling of fullness and increases your risk of infections. Your bladder never gets the satisfaction of complete emptying, so it signals the need to urinate more frequently. Those frequent nighttime trips occur because your bladder never truly empties during the day, so it reaches capacity faster. Your sleep becomes fragmented, your energy plummets, and your quality of life suffers in ways that extend far beyond bathroom troubles. Many men tell me they avoid social situations or long car trips because they are worried about finding bathrooms. The dribbling after urination happens because urine gets trapped in the compressed portion of your urethra and releases when you move or relax. This creates that embarrassing moment when you think you are finished, only to discover wetness in your underwear minutes later. Before we explore natural solutions, you need to understand what conventional medicine offers. TURP, or transurethral resection of the prostate, involves scraping away prostate tissue through your urethra. Green light laser therapy vaporizes prostate tissue using high-energy laser beams. Radical prostatectomy removes the entire prostate gland. These procedures can be effective, but they come with significant risks that are often downplayed. Retrograde ejaculation affects up to 90% of men after TURP, meaning semen flows backward into the bladder instead of out through the penis. Urinary incontinence can persist for months or become permanent. Erectile dysfunction occurs in 10 to 15% of cases. Some men experience chronic pain or urinary urgency that is worse than their original symptoms. I am not saying surgery is never necessary, but I am saying it should be considered only after you have given natural methods a genuine trial. Your body deserves that chance. The irreversible nature of these procedures means you cannot go back if results are not what you expected. Natural Method 1: Double Voiding Technique. This simple technique can immediately improve your bladder emptying, and it costs absolutely nothing. After you finish urinating, wait 30 seconds, then try again. You will often find that more urine comes out. This second void can be surprisingly substantial, sometimes as much as the first attempt. Technique works because it gives your bladder muscles time to reset and contract more completely. During that 30-second pause, the residual pressure in your bladder redistributes, allowing for more complete emptying. Many of my patients report significant improvement in their sense of complete emptying within just a few days of practicing this consistently. Make this part of your routine every time you urinate. Set a mental timer for 30 seconds after you think you are finished. Use this time to relax, take a deep breath, and then attempt to urinate again. You will be amazed at how much additional urine you can expel with this simple technique. Some men find it helpful to lean slightly forward during the second attempt, or to gently massage the area just above their pubic bone. These small adjustments can help encourage complete bladder emptying. Key is consistency. Do this every single time you urinate, and within a week you will likely notice a significant improvement in how completely your bladder empties. Natural Method 2: Pelvic Floor Strengthening. Your pelvic floor muscles support your bladder and help control urination. Like any muscle, they weaken with age and disuse, but they respond beautifully to targeted exercise. These muscles are like a hammock that supports all your pelvic organs, and when they are strong, they provide better control and support. Start with basic Kegel exercises. Contract your pelvic muscles as if you are stopping urination midstream. If you are unsure which muscles to engage, try stopping your urine flow next time you urinate. Those are the muscles you want to strengthen. Hold this contraction for 5 seconds, then relax completely for 5 seconds. Repeat this cycle 10 times, 3 times daily. As you get stronger, increase the hold time to 10 seconds. You can do these exercises anywhere, while watching television, driving, or even during conversations. No one will know you are strengthening muscles that can dramatically improve your urinary control. The beauty of Kegel exercises is their complete privacy and convenience. Advanced pelvic floor work includes elevating your legs while doing Kegels, which increases the challenge and effectiveness. Try doing your exercises while lying down with your knees bent or while standing against a wall. Vary your positions to strengthen these muscles from different angles. Natural Method 3: Hip and Pelvic Stretching. Tight hip flexors and pelvic muscles can compress your pelvic organs and worsen prostate symptoms. Modern men spend too much time sitting, which creates chronic tightness in the hip flexors and surrounding muscles. Regular stretching creates space and improves blood flow to the entire pelvic region. Try the butterfly stretch. Sit on the floor, bring the soles of your feet together, and gently press your knees toward the ground. Hold for 30 seconds and breathe deeply. You should feel a gentle stretch in your inner thighs and hips. Do the hip flexor stretch by stepping into a lunge position and sinking your back hip forward. This targets the muscles that become chronically tight from prolonged sitting. These stretches should feel good, not painful. Gentle, consistent stretching is more beneficial than aggressive attempts to force flexibility. Spend 10 minutes daily on pelvic stretching, and you will likely notice improvements in both urinary symptoms and overall pelvic comfort. Add the child pose from yoga to your routine. Kneel on the floor, sit back on your heels, then fold forward with your arms extended. This gently stretches your entire pelvic region while promoting relaxation. Pigeon pose, where you bring one ankle up onto the opposite thigh while seated, targets deep hip muscles that affect pelvic organ positioning. Natural Method 4. Anti-inflammatory nutrition. What you eat directly affects prostate inflammation, and this is where many men can see dramatic improvements. Processed foods, excess sugar, and refined carbohydrates fuel inflammation throughout your body, including your prostate. Chronic inflammation makes every prostate symptom worse and accelerates prostate growth. Focus on foods that fight inflammation naturally. Tomatoes contain lycopene, which specifically benefits prostate health. Cooking tomatoes actually increases lycopene availability, so tomato sauce and paste are excellent choices. Fatty fish like salmon, sardines, and mackerel provide omega-3 fatty acids that reduce inflammation throughout your body. Nuts and seeds, particularly pumpkin seeds, supply zinc and other minerals that support hormone balance and prostate health. Leafy green vegetables like spinach and kale provide folate and antioxidants that combat cellular damage. Berries contain compounds that specifically reduce prostate inflammation. Reduce or eliminate foods that worsen inflammation. Sugary drinks create insulin spikes that promote inflammation. Processed meats contain preservatives and compounds that increase cancer risk and inflammation. Fried foods contain damaged fats that your body treats as foreign invaders, triggering inflammatory responses. This is not about perfection, it is about making better choices more often than not. 80% of your food choices support prostate health. You will see results. Start by replacing one inflammatory food with an anti-inflammatory option each week. Small, sustainable changes create lasting improvements. Natural Method 5. Strategic fluid management. How and when you drink fluids significantly impacts your symptoms, yet most men have never been taught proper fluid timing. Consuming large amounts of liquid before bed guarantees multiple nighttime bathroom trips. Caffeine and alcohol irritate your bladder lining and increase urgency, creating a cycle of frequent urination. Drink most of your fluids earlier in the day, tapering off as evening approaches. Stop drinking liquids 2 to 3 hours before bedtime. This gives your body time to process fluids and reduces nighttime interruptions. When you do drink, choose water over caffeinated or alcoholic beverages. This does not mean becoming dehydrated. Adequate hydration is essential for overall health and can actually help reduce urinary tract infections. Key is timing your fluid intake strategically. Concentrated urine from dehydration irritates your bladder, but properly timed hydration supports healthy urinary function. Consider the timing of medications that affect urination. If you take diuretics or blood pressure medications, work with your doctor to optimize timing so they do not interfere with sleep. Some men benefit from taking these medications earlier in the day to minimize nighttime effects. Herbal teas like nettle root or saw palmetto can provide gentle prostate support while contributing to your daily fluid intake. Green tea contains antioxidants that benefit prostate health, but drink it earlier in the day to avoid caffeine interference with sleep. Natural Method 6. Regular physical activity. Exercise benefits your prostate in multiple ways that extend far beyond general health. Cardiovascular exercise improves blood flow to pelvic organs, delivering nutrients and removing waste products more efficiently. Strength training helps maintain healthy hormone levels, particularly testosterone balance that affects prostate size. Even moderate activity reduces inflammation throughout your body. When you exercise regularly, your body produces fewer inflammatory compounds and more anti-inflammatory substances. This creates an internal environment that supports prostate healing rather than continued enlargement. You do not need to become a marathon runner or spend hours in the gym. A 30-minute walk daily provides significant benefits for prostate health. Walking improves circulation, reduces inflammation, and helps maintain healthy weight, all factors that benefit your prostate. Swimming is excellent because it exercises your entire body without stressing your joints. The horizontal position and rhythmic movement promote healthy circulation to pelvic organs. Water pressure provides gentle compression that supports circulation while reducing inflammation. Resistance training 2 to 3 times weekly helps maintain muscle mass and hormone balance. As men age, muscle mass naturally declines, which affects hormone production. Maintaining muscle through resistance exercise supports healthy testosterone levels and overall prostate health. Find activities you enjoy because consistency matters more than intensity. Your prostate responds to regular movement, not sporadic intense exercise. Whether you prefer gardening, dancing, hiking, or playing sports, regular movement provides cumulative benefits that improve over time. Natural Method 7: Quality sleep optimization. Poor sleep disrupts hormone production and increases inflammation in ways that directly worsen prostate symptoms. Men who sleep poorly often experience worse prostate symptoms, creating a vicious cycle of nighttime awakenings that prevent restorative sleep. Growth hormone, testosterone, and other healing hormones are produced primarily during deep sleep phases. Create a sleep-friendly environment. Keep your bedroom cool, ideally between 65 and 68 degrees. Darkness is crucial. Consider blackout curtains or an eye mask. Even small amounts of light can disrupt hormone production. Keep your bedroom quiet or use consistent white noise to mask disruptions. Avoid screens for at least an hour before bedtime. The blue light emitted by phones, tablets, and television suppresses melatonin production, making it harder to fall asleep and achieve deep sleep phases. If you must use devices, consider blue light filtering glasses or apps. Establish a consistent sleep schedule, going to bed and waking up at the same times daily, even on weekends. Your body thrives on routine, and consistent sleep timing helps regulate hormone production and natural circadian rhythms that support healing. Consider relaxation techniques like deep breathing or meditation before bed. These practices activate your parasympathetic nervous system, promoting both better sleep and reduced pelvic tension. Progressive muscle relaxation, where you tense and release muscle groups systematically, can be particularly effective for men with pelvic tension. These natural approaches work, but they require patience and consistency. You will not see dramatic changes overnight. Most men begin noticing improvements within 2 to 4 weeks, with more significant changes developing over 3 to 6 months. Your body needs time to reduce inflammation, rebalance hormones, and adapt to healthier patterns. Track your progress by noting how many times you wake up at night, rating your stream strength on a scale of 1 to 10, and assessing your sense of complete emptying. Small improvements accumulate into meaningful changes in your quality of life. Keep a simple log for the first month to see patterns and progress. Remember that surgery and medications remain available if natural methods do not provide sufficient relief. But give your body the chance to heal itself first. You might be surprised by what is possible when you support your natural healing mechanisms instead of fighting against them. Your prostate health is not something you have to navigate alone. By implementing these natural strategies consistently, you are taking control of your health in a way that honors your body's natural healing capacity. You are choosing to work with your body rather than against it. Subscribe to this channel if you found this information valuable. Share in the comments which method you are most excited to try, or let me know what other men's health topics you would like me to address. Building a community where men can openly discuss health challenges benefits all of us. Your journey toward better prostate health starts with the decision to try these natural approaches. Your body has been supporting you for decades, now it is time to support it back.